फिर उसको बैठने के लिए कहिए। बैठने के बाद में आस्क हिम टू मेक हिज लेग स्ट्रेट। जब पैर सीधा करेगा तो आपको दिखेगा कि नॉर्मली आप लोग पैर सीधा करेंगे तो जमीन के बीच में से, जमीन और घुटने के बीच से आप हाथ नहीं डाल सकते, बिकॉज इट इज स्नगली फिटिंग ऑन द फ्लोर। लेकिन जो घुटने का दर्द है उसमें क्या होगा, थोड़ा ऐसा एंगल रहेगा, तो आप आपकी उंगली अंगूठा नीचे डाल सकते हैं। तो इसके लिए क्या करेंगे, ये हाथ ऐसा रख के उसको 3 बार ऐसा प्रेस करेंगे, तो उससे क्या होगा, ये जो एंगल आया था वो आहिस्ते आहिस्ते कम होने को मदद होगी। So this you will do for 5 times. Then hold the leg to raise the knee joint, making about around 45-degree angle, and then make it straight. First do it with both legs and then alternately for 10 rounds. पैर मोड़ना है एंड पीठ के ऊपर लेट जाना है। सो दिस इज ए नॉन वेट बेयरिंग नी जॉइंट मूवमेंट। अभी हम चलते हैं तो पूरा शरीर का बोझा उसके ऊपर आता है ना, तो पीठ के ऊपर लेट जाना है, फिर 90 डिग्री हलासन करना है और दोनों पैर घुटने में मोड़ के बेंड करो सीधा करो, बेंड करो सीधा करो, ये 10-20 बार करो। तो दिस इज ए नॉन वेट बेयरिंग नी मूवमेंट।
सर एक्सप्लेन इन इंग्लिश सर ये सेशन।
हाँ, you lie down on the back all the time when you are walking. Your both the knees are bearing the whole weight of your body. So these are all weight bearing movements of the knee joint. Now, because of the weight bearing movements of the knee joint, there is more wear and tear. So we have to eliminate the weight. Now, how it can be possible? So lie down on the back, make 90 degrees halasan, and then at the knee joint, just bend the leg 90 degree, make it straight. Bend it, make it straight. So what has happened? The knee movements are happening, but it is without weight. So patient, the bones are not bearing the weight of the body. So that is how it will help to strengthen the muscles around the knee joint. Any doubt about this? Then you have to lie down, then make a 45 degrees halasan on the back only and bring it down. Again, raise it, hold for 10 counts, again bring it down, 45-degree angle. So that will strengthen the thigh muscle. Then raise the leg straight up to 30 degrees. Lie down on the back and raise the leg about 30 degrees and try to hold it in position for as per your capacity. Count for 5, 10, 15, 20 like that, so that till as per your individual capacity. Don't try. Suppose I tell count it for 20 and after counting 5 your legs start tremoring. So keep it down. Tomorrow after 5 days, 10 days, you might be able to hold it for 10 seconds or 10 counts. So raise the leg straight up to 30 degrees up in air and hold it in as per your capacity. Do it with other leg 5 rounds. Then keep both the knees side by side with closed fist of hand in between it. You can keep both the fists like this in between the knee joint of the both legs. So what will happen? These are the two legs. In between the two legs, you put the both the fists at the knee joint, and then try to contract the leg so that they will press both the fists. So this will help to strengthen the muscles of the adductor and abductor muscles. Lateral और medial side के जो muscles है थाई के, वो contract होंगे तो उनकी थोड़ी tensile strength capacity बढ़ सकती है। तो ये 10 बार करना है। आया समझ में? Keep both the knees straight, then put your both the fists in between your knee joint and press with the both the knee joint. Then another thing is, these are the two fingers. Now make your legs straight. You are in a sitting position and put these both the index finger and middle finger just below the knee joint, below the patella, कभी कभी हम उसको वो आंखें बोलते हैं नी जॉइंट की, तो वहां पे रखे एंड प्रेस इट एंड काउंट 20. Again release it, again press it, count 20. What is the importance of this? If you try to see, sit on the floor, to make your legs straight, and just below the knee joint, below the patella, you will find there are two eye-like projections, and these are the places where whenever there is injury to the knee joint, there is a swelling. What is the swelling of the knee joint? In the knee joint, there is a secretion of the fluid,
Knee fusion.
that is synovial fluid. That synovial fluid, normally it is meant for making the movement of the both the bones smooth. Whenever they are making movement, they should not rub against each other. But when there is injury, what happens? Because of the reaction, more fluid is secreted, and then it is called, what madam said, effusion. That is called knee effusion. Now, usually that effusion, it comes out from that two places. So just try to feel yourself on your knee joint. You will find just below the patella, on the there is in the center there is a tibial tuberosity. The tibial bone, there is a small projection. Just feel yourself. You make your leg straight, and just below the patella, you will find a bony prominence. That is called tibial tuberosity. This is the bone of the leg, tibia. And that tibial tuberosity on the both sides, if you put your both the fingers like this, it will press the area from where that synovial fluid comes out. Have you understood this? Those 2 points are the points from where the synovial fluid comes out, and that is how you will see that somebody's knee joint is swollen. घुटना सूजन आ गई कब दिखती है? जब अंदर का जो साइनोवल फ्लूइड है, which was secreted, because more fluid was secreted because of the injury to the bone, it is coming out through that point, and then the knee joint becomes swollen. So if you press on that, it will help to improve the tensile strength of that particular hole. And if you start doing practices, asanas, it will help to improve the movement of the bone. Slowly that fluid may get absorbed and effusion may reduce.
Sir, like this,
And yes, right. Put your, now see, 1 minute. Okay, you continue like that. You put your
I will pin her for everybody. I will pin her for everybody.
Yeah.
She I have spotlighted Priya ji.
Put your hand on the patella, flat. Now slowly slide it down. You will feel a bony prominence of the leg bone. Are you able to feel? Just below the patella, घुटने के वाटी के just थोड़ा नीचे. So that is a tibial tuberosity. ये जो है ना, this is a tibial tuberosity. Have you understood? See, this is that leg bone, tibia. और ये यहाँ पे patella होता है. The patella bone is here, kneecap. And if you slide your finger down, you will feel here the bony prominence. Can you feel, madam?
yes, sir.
Now this is called tibial tuberosity. Now on both sides of this, you have to put your both the fingers like this. Press it. So whenever there is a effusion of the knee joint, when the joint is swollen, this synovial fluid secreted into the joint, it comes out through this opening and it spreads all over this area, and that is how your knee joint looks to be swollen. So you try to improve the tensile strength of that two particular opening so that they will not come out through that, and because of the movement, slowly this excess fluid will get absorbed.
Thank you, Priya ji. Thank you.
Okay, sir.
सर नी जॉइंट में जब स्वेलिंग ज्यादा होता है ना पर्टिकुलर लेडीज को, तो वो डॉक्टर क्या करते हैं एलोपैथी में, वो इंजेक्शन से फ्लूइड निकाल देते हैं, बोलते कि फ्लूइड सड़ गया है। मैंने गांव में देखा है, एक मौसी का किया था नेबर में।
As far as possible, don't try to do that because it is a reactionary fluid. Because of the injury, trauma, now what has happened because of the trauma, this end is rubbing against this. So this is a natural phenomena. By increasing the fluid secretion inside the bone joint, it tries to separate the two ends of the bone so that rubbing may be reduced. So this is a nature's buffer system. Now, if you give rest to that part, if there is no rubbing against each other and rest to the part, slowly what will happen? Whatever this excess fluid was secreted, it will be get absorbed. Because normally also in each joint, some fluid is secreted. I told you reason that it helps to maintain the movements of the bone because of the watery synovial fluid. Little slippery is there, so they don't rub against each other. So they prevent the degeneration of the bony end. Now, every day some fluid is secreted. Suppose every day 5 cc is secreted. So after 1 month, 30 into 5, it will become 150, isn't it? But it doesn't remain there. So as it has got the ability to secrete the fluid to maintain the slippery position so that bone doesn't rub against each other, similarly, it doesn't remain over there. It gets absorbed. So effusion has occurred. What is the best treatment? Give rest so that it is still not rubbing. And if you give rest, the rubbing is not there. So fresh fluid is not generated in excess. And water fluid is there, it is getting slowly absorbed. If you try to remove it with the injection, it is dangerous because sometimes because it has got more complications than the benefit. We say that when you are operations करते हैं, अभी मैं पेट का ऑपरेशन करता हूँ पेशेंट का, तो यदि आप बोले मुझे ऑपरेशन देखने का है तो मैं बोला आ जाओ, ठीक है, कैप मास्क पहनो, अंदर एंट्री दे देगा. लेकिन नी जॉइंट का ऑपरेशन है, जॉइंट का ऑपरेशन है, ऑर्थोपेडिक थिएटर है या आंख का ऑपरेशन है, वहां पे किसी को भी देखने के लिए अलाउ नहीं करते. क्यों नहीं करते? बिकॉज इट इज सेड दैट यू कैन स्पिट इनटू द एब्डोमेन. एब्डोमेन हमने ओपन किया है, काटा है, और उसमें हम स्पिट किया तो भी कुछ ज्यादा फर्क नहीं पड़ेगा, बट यू कैन नॉट ब्रीथ इन द जॉइंट. अंडरस्टूड द इम्पोर्टेंस? So, if you are not expected to breathe in the joint also, so that air also should not go there. Similarly, if you try to put the needle and withdraw the fluid so that the effusion will be reduced, sometimes infection may be introduced and patient may get problems. So, as far as possible, don't try to remove the fluid by syringe. सुई से इंजेक्शन से पानी मत निकालो, जितना हो सके उतना. ठीक है? Then weightless movement, I just explained. Lie down in supine position, raise both the legs and to 90 degrees and up to halasana, and fold the legs at knee joint and make movement 20 times. So it will be a weightless movement. Then also lie down on the tummy and fold the legs at knee joint. पेट के ऊपर लेट के पैर घुटने में मोड़ो, नजदीक लो, दूर करो, नजदीक लो, दूर करो. So again here you are avoiding the weight. So these are all weightless movements. Then sit on chair and keep both the knees together and keep little distance between the edge of the chair and knee joint and make the legs straight up and down from knee joint for 20 times. चेयर के ऊपर बैठ के दोनों पैर फोल्ड है, सीधे करो, hold it for some time, again keep it down, again keep it up, hold it for some time, again what you have done, you have avoided the body weight because these movements are weightless movements. So these weightless movements, they will help to improve the tensile strength of the muscles. Because whenever any muscle is working against resistance, against force, then the chances of wear and tear are more. That is why when the weightlifter is lifting the weight, he is trying to lift the weight more than his capacity. That is why the muscles, because his brain has given the order that you have to lift 100 kg weight. Initially, he starts with 50, then he goes to 60, 70. But his capacity is only to lift the weight up to 70. But then he has to achieve the target of 100 kilo. So what he does, he tries to lift it. And then, so all his muscles, they try to contract to help to lift that 100 kg weight. And in that, sometimes it may happen that muscle get torn. If you stretch the elastic rubber too much, what happens? Up to a certain extent, it goes on stretching. And at one moment, what happens? It breaks into two. So it loses its capacity. So here also, when you are doing this weightless knee movement, the muscles are not contracting against resistance. So chances of wear and tear are less, but on the contrary, it helps to improve their tensile strength. Any doubt about this?
About the
can-
practices we have done, we can take a session for practice later on when all the
Yeah,
lectures are
another thing, you can go on my YouTube channel and there you will find the knee joint and back pain exercises. That they are all detailed and I have demonstrated it personally. So you can see it for yourself, and if any doubt is there, you can ask me next time. Okay?
Sir, whatever practices you have suggested, that
Yeah.
even a person can do it. I mean, you don't have to wait for the
Yeah.
knee joint.
Yeah, it will help as a preventive, no doubt about it. So after the age of 40, 45, if you start practicing this, you can keep your knee joint proper. Why to wait till they become worse and they start crying and complaining that I'm not able to bear your weight? So better do it before that only. Okay. So we'll go to the next, is the rheumatoid arthritis. Yeah.
सर ये जो एक्सरसाइजेस है जिसमें हम क्वाड्रिसेप को स्ट्रॉन्ग करके उसको सपोर्ट कर रहे हैं, लेकिन कुछ केसेस में ऐसा होता है कि क्वाड्रिसेप टाइट होने की वजह से नी पेन है, या मेरे एक स्टूडेंट को हुआ था, वो साइड स्ट्रेचिंग कर रहे थे हनुमानासन, और वो अच्छा जिम में भी एक्सरसाइज करते, फिटनेस अच्छा है, बट हनुमानासन किया और पीछे जो पैर था ना उसका पटेला निकल के साइड के इसमें पूरा का पूरा शिफ्ट हो गया इधर। फिर उसको हमने ऐसे-ऐसे करके अंदर डाला, फिर वो बहुत ही पेनफुल कंडीशन था, 2-3 दिन मेडिकेशन लेने पड़े। और दूसरे इसमें एक लड़की को सिर्फ धक्का लगा, वो गिर गई नी के ऊपर और सेम उसका जो पटेला है वो साइड में गया।
इसलिए मैं हमेशा बताता हूँ, पहले भी शायद बताया होगा मैंने, कि बलपूर्वक करेगा तो बलहानि होगी। तो कोई भी चीज आसन करने का है तो अपने इंडिविजुअल कैपेसिटी के हिसाब से करेंगे। मुझे वो फाइनल स्टेज अचीव करना है, इसलिए मैं जबरदस्ती करती हूँ। तो उसमें क्या हो गया, दैट मसल वॉज टोटली overwork burden, and that is why that patella got slipped and she got dislocation of the patella, and she must have got the some of the fibers torn also. Now what is the treatment for that? As you said कि उसको थोड़ा हम patella को जगह पे बिठाया, and then you have to give total rest. Now another principle you remember, whenever I usually tell like this, कि बलपूर्वक करेगा तो बलहानि होगी. If you do it with force, you will get damage only. Now suppose something happens, such thing happens, then we have to give total rest to that part. So let that torn fiber heal, because body has got a healing power. Now if the fiber is torn, if you give rest, it will heal. So you give, that's why I said if somebody gets any problem practicing yoga, stop it for 1 month. Don't do anything. So whatever damage has occurred, I'm going to take one lecture on injuries in yoga also. There also I'll explain. योगा इंजरीज के ऊपर भी एक थोड़ा सेशन रहेगा, तो उसमें मैं एक्सप्लेन करेगा. तो फर्स्ट थिंग इज दैट बलपूर्वक नहीं करे, डोंट यूज फोर्स, डू इट एज पर इंडिविजुअल कैपेसिटी. नेवर ट्राई टू अचीव द फाइनल स्टेज ऑन द वेरी फर्स्ट डे, क्योंकि हम सब लोग हमारे शरीर को बहुत लाड़ प्यार से संभाल के रखते हैं. So it hasn't got a habit of flexing, or it's not that flexible. And in that case, suppose you do, what happens in sprain? When you are walking, suddenly there is a twist. So this is abnormal movement. Now when such twists happen, what happens? These side muscles are stretched too much. And in that case, what happens? Sometimes some of the fibers may give way and may rupture. Now, what is the treatment? Suppose you go to the doctor, orthopedic surgeon, what he will do? He will give a plaster or crepe bandage. What is the importance of that? You try to immobilize that part. By immobilization means what will happen? You are not making any movement. So you are giving total rest to that part, so that whatever fibers are ruptured, they will heal. So what is the first basic principle? Don't use force. Let anybody practice the yoga asanas as per his individual capacity. If he starts getting pain, stop it totally for at least 1 month, so that whatever damage has occurred, whatever the fibers have got ruptured, they will heal properly, and then you can again slowly start step by step. Never try to go for the final stage of any asana. Okay. So now coming to the rheumatoid arthritis. It is a chronic inflammatory autoimmune disorder. What is autoimmune?
बॉडी की इम्यून सिस्टम जो अच्छे फाइट करने वाले सेल्स है उसी के ऊपर अटैक करती है.
अच्छे, रिपीट अगेन.
बॉडी के जो फाइटिंग सेल्स होते हैं ना, वो जो अच्छे सेल्स है उन्हीं के ऊपर अटैक करते हैं.
थोड़ा मॉडिफाई करो. अच्छे सेल नहीं, जो अपनों को पहचानने को भूलता है. The one who forgets to identify our own cell. Now body has got, as you said, defensive mechanism cells are there, and these cells, they are not identified by these cells, and they try to kill the normal cell of the body. अपनों को पहचानना भूल जाते हैं. The cells that do,
your immune system mistakenly damages our
Yeah.
healthy cells in our body.
they think that they are foreigner, इसलिए उसको मार डालते. So that is a autoimmune disorder. Now this is not because of some organism or bacteria, but it is a self body mechanism, and some genes problems also sometimes is there. Now in this what happens, it is usually chronic inflammatory process affecting small joints and afflicting younger age population. It leads rapid destruction of the articular cartilage. Articular cartilage means the ends of the two bones which are forming the joint. Now these articular cartilage, their destruction occurs, and that is why the movements of the joint are hampered. That's why you must have seen rheumatoid arthritis people, they have got a hand like this. Their fingers are diverted like this. Why? Because this side bone has been totally eaten up. That is why there is a pain. And to compensate it, the other side muscles, they contract. And that is why his fingers are deviated on one side. Being an autoimmune disorder, the immune system mistakenly attacks the own body cell tissue, mainly small joints of the hands and toes, leading to pain. Symptoms. Now, how to differentiate between a osteoarthritis and rheumatoid arthritis? Osteoarthritis, you will get only pain, but there may not be any swelling. There may be, but not commonly. And the temperature, local temperature of the joint will be normal in a osteoarthritis in the aging patient. But in rheumatoid, the tender, warm, swollen small joints, usually bilaterally symmetrical affection in a young age group is seen. Means यंग एज ग्रुप में दोनों हाथ इन्वॉल्व है, दोनों हाथों के जॉइंट्स में है, छोटे ये जो फिंगर जॉइंट्स है उसमें सूजन आती है. एंड इफ यू टच द जॉइंट इट विल बी लिटिल वार्म. वार्म मतलब उसका टेम्परेचर थोड़ा बढ़ा हुआ लगेगा. सो दैट इज हाउ यू कैन डिफरेंशिएट बिटवीन अ ऑस्टियोआर्थराइटिस ऑफ एजिंग पर्सन एंड rheumatoid arthritis. Then because of this the joint will become stiff, the movements will be difficult. Patient will have fatigue, fever, and weight loss. So these are the symptoms of the rheumatoid arthritis. Now, what are the risk factors? It is more commonly seen in the women prone to rheumatoid arthritis as compared to the men. Age, rheumatoid arthritis commonly begins at age of 30 up to 50. However, it can also occur in younger age group, teenagers too, when it is called juvenile rheumatoid arthritis. जब बच्चों में होता है उसे juvenile कहते हैं. और कौन सा एग्जांपल दे सकते हैं? एनीबडी नोज? जुवेनाइल वर्ड किधर और यूज किया जाता है?
डायबिटीज में सर.
करेक्ट. जुवेनाइल डायबिटीज, that is the children below the age of 10 or 13, their insulin is not at all secreted. The islets of Langerhans which are there in the pancreas which secrete insulin, they are not there, and that is why they develop diabetes, and that is called juvenile diabetes. Correct. Then family history. Usually you will find if one of the family member having this disease, but it is not communicable. It is only sometimes transmitted through the genes. Then smoking. Cigarette smoking increases the risk of development of rheumatoid arthritis in genetically predisposed persons. Matlab, if somebody parent, they have got one of the parent has got a rheumatoid arthritis, and his son, he may not be having, but if he starts smoking, then years after smoking, he may develop rheumatoid arthritis. So this is one of the predisposing cause. Then environmental factors. Exposure to asbestos and silicosis may increase the risk of developing rheumatoid arthritis. Obesity. Obese persons are likely to have rheumatoid arthritis than non-obese people. So the risk is more in obese people. Now, what yoga module you can give? When patient has got acute pain, movements are not possible, there is a warmness, matlab joint jo hai, it is painful and it is temperature, local temperature is raised. In those conditions, it is sometimes somewhat it is acute condition. So patient has to take medical line of treatment. Once the acuteness is over, once the pain has gone, warmness is gone, but only you can see that his both the fingers, they are turned like this and there is little swelling over there and little pain is there. Those patients